Hi everybody. I just wanted to hop on real quick to give an update from yesterday's events. I had an upper endoscopy done by my GI doctor here in Indiana, and this is my third endoscopy that I have had done so far. And I was having trouble swallowing. It felt like food was getting stuck. It was really painful eating. And I've lost 6 pounds in a couple weeks, which is really not good. Half the time I feel like I'm starving, and then so I start to eat, and it's just so painful. I get so nauseous and so sick. It's just no fun. And so they decided to go back in for an endoscopy to sort of see what they could find. And when they went in, they found that I had esophagitis, which he's not exactly sure why I'm still having inflammation because I'm on multiple reflux medications. And so really the inflammation should be down. Also, they found a lot of white patches throughout my esophagus, and they're thinking that that is yeast and that it's causing some issues in my gastrointestinal tract because it's overgrowing. They did take biopsies just to make sure that's what was going on, and look for other bacteria and things. I had just been on a treatment of nystatin, like the drinkable kind of nystatin, to sort of, because he had thought that maybe I had yeast before they had done the upper GI, but obviously the nystatin didn't take care of the yeast infection, or it's not yeast. So my gastro person is sort of at a standstill because he's not exactly sure what to do at this point. And so he's waiting to see what the Cleveland Clinic sort of thinks about this stuff. And I have all the records and pictures that he took and stuff like that. But hopefully this new antibiotic that he's putting me on will help whatever's going on in there. Right now at this point. He did say because I am on many immunosuppressive drugs that it can cause an overgrowth of yeast in my gastrointestinal tract, and so he said this could be like an ongoing battle if that's what it is. So yeah, and it was interesting because the person that accessed my port, she had to have somebody else come in and help her stabilize my port while she put the needle in, which is really weird for me because I've never had someone that wasn't able to just access it themselves. So that was interesting as well for that. But that's basically the update from the testing that was done yesterday. So we'll take all this info to the Cleveland Clinic, and they may want to do their own testing to sort of see what's going on with that aspect of things. But until then, I'll just continue to try to sort of force eat, and hopefully we'll sort of get stuff figured out. So I'll talk to y'all later.